Good afternoon. Welcome to our webinar on COVID-19 and pregnancy. We appreciate this is a very difficult and confusing time for everybody, particularly for pregnant women. Hence, we've held this webinar to help address some of your main concerns and worries during this period. So I'm pleased to say that we have one of our senior GPs joining us today called Dr. Nadia Khalid, who is an expert in female health. She's also a mother of two and can definitely understand how worrying this period of uncertainty could be. Today she's kindly agreed to answer some of the main common questions that patients have and hopefully to help support during this time. Before I pass on to Dr. Khalid, I just want to note that all the information and advice given today is correct and up to date as of 1st of April. As things are changing daily, these guidelines and advice may change in future. So, good morning, Dr. Khalid. Thank you for joining us. If you can say a few words.
Good morning, Shabnam. Thank you for having me here. Welcome everyone to this webinar on COVID-19 focusing on pregnancy. As Shabnam rightly said, it is quite a stressful moment for all of us at the moment, at this point. I know a lot of you are going through a lot of anxiety, and there might be a lot of questions with uncertainty that might be going in your head. The purpose of this webinar is hopefully to alleviate some of the anxiety by answering the questions you've got and also providing support from first care practice. I'll try to make this webinar as interactive as possible. Shabnam has got a few questions which she will be putting forward. You will also get the opportunity to have your questions, which you can actually type it in the Zoom chat box, and we will try to answer those as much as we can, or as many as we can. To begin with, I would like first for all of you to do a little a survey. Let me show you a little picture of a feeling wheel, please. Can we have that up there? So this is basically a feeling wheel. It displays different emotions that we might be going through at the moment. And I think this feelings wheel is quite a useful tool because it helps us get a better understanding and an insight of what a person might be experiencing given at that particular time. So now we will do a little survey. I would like you to answer, all of you to answer this, take this little survey and answer. There's not a right or wrong answer, so can we have that poll up there, please? Thank you. So all of you, if you can kindly take your time and then answer the question. You've got 10 seconds. Okay, 5, 4, 3, 2, 1, and it can be closed. Okay, so I can see there's a mixed response. People are fearful, about 33%, and then there are some people who are disgusted because of I hope it is because of the current situation and not the fact that you have to attend this webinar. And there are people who are happy. Okay, so now let me quickly go through some of the symptoms of COVID-19 that you can be presented with. Can we have the slide, please? Okay, so there's a lot of different symptoms that people are experiencing. The most common symptoms, and the one that the Public Health England have got on their website, is fever and a cough, which is dry. A fever is described as 37.8. If you haven't got a thermometer, you can use your hand to touch your chest, and if it feels warm, then that is taken as a fever. People have also reported symptoms of fatigue, aches and pain, sore throat, and headache. One thing I would like to mention, if there are symptoms of shortness of breath, that should also be taken as a COVID-19 symptom, and it should not be ignored. Sneezing is not one of the symptoms of COVID-19, and some people have reported diarrhea as well, which is again a rare symptom. So I would like you to focus mainly on the fever and cough. If you do experience these symptoms, you need to give NHS 111 a call. Okay, now I would like the question answer session to be started, Shabnam.
Yes, okay, so these are some of the common questions from our patients. Main one is, are pregnant women more risk of developing COVID-19?
So the pregnant women are not necessarily more susceptible to the virus. But however, as you are aware that during pregnancy, your immune system alters, and that itself can be associated with you developing the symptoms. So I would say that in most of the pregnant women, if they they do develop symptoms of COVID-19, it is usually between mild and moderate. However, there is one high-risk group, which is usually women who've got a heart or a lung condition that puts them in a higher group. And in that particular category, or if you develop symptoms in your third trimester, it has been shown that the symptoms usually present severely as compared to people who are in their first and second trimester.
Okay, thank you for that. So another concern that many patients are worried about is when they are pregnant, is that they can pass it on to the baby, and if so, what would the effects be on the baby?
Okay, so as you're aware, Shabnam, that this virus is new. So there is limited evidence that is available on that. A small number of cases of baby born with mother with COVID-19 have reported to be positive with COVID-19 at birth. So the possibility of transmission in the womb is there, but it's not certain. However, the cases that in babies who reported to be positive, it has been shown that they have got very mild symptoms, or the baby is otherwise quite well. So that's a positive sign to look for.
Thank you, Dr. Khalid. So as we can appreciate, the birth process is quite a special but stressful time, and in normal situations you are allowed to take a birthing partner with you. Another worry is during this coronavirus issue, are pregnant women allowed to take somebody with them, like their partner or family member, to assist in the birth process?
So I think it is very important for us to remember that at all time, social distancing need to be practiced. Again, which we all appreciate that this is a very difficult moment for any pregnant woman when they're going into labor. They are definitely allowed to take one birthing partner, regardless whether they do or they do not have COVID-19 symptoms. If they do not have COVID-19 symptoms, we are requesting no visitors to be allowed in the labor or in the maternity unit apart from the birthing partners. If you, however, you do have COVID-19 symptoms, you need to contact the maternity unit, and they would be arranging a special or a private transport for you to bring to the unit. When you arrive at the unit, you will be given a special a mask to wear at all times until you are isolated. So the answer to your question, yes, you are allowed one birthing partner, but extended family member or more than one partner are not allowed at the moment.
Thank you, Dr. Khaled. That was very informative. So another question that we are commonly asked is, will patients still be having antenatal appointments and follow-ups, and would they still have to attend these appointments in hospital due to, as you mentioned, issues around social distancing and self-isolation? Will they still have to attend these hospital appointments?
Yes, so it is strongly advised that all the antenatal appointments would be continued. However, you need to contact the maternity team because there might be a reduced number of antenatal appointments, but we do encourage all pregnant women to attend the antenatal appointments as advised by your maternity unit. If again, and I would like to say that over and over, that if you do have symptoms of COVID-19 or if you're infected with COVID-19, then you need to let your maternity unit aware beforehand and do not attend the antenatal appointment without letting them aware. They might arrange special isolation rooms, or there might be special measures that need to be taken before your antenatal appointment can be carried out.
Thank you. And finally, just a last point before we move on to questions. So there's a lot of confusion about working. A lot of pregnant women work in healthcare or in jobs where they are facing the public. So they're concerned about whether they should still be continuing to work. And if not, do they need some sort of note or proof from their doctors or GPs to advise that they should be self-isolating? Can you share your thoughts on that, please, Dr. Khalid?
Okay, so your first question, whether they would be working or not. So what the guidance is at the moment, social distance need to be practiced at all times. If you are in your first trimester, it's usually recommended that if you're in your first or second trimester with no underlying condition, you can continue to work even if that would involve public facing. And that's an arrangement that can be discussed with your employer or occupational health. However, if the possibility of home working or working from home is available, then we are strongly encouraging patients to use that. If you are in your third trimester, then of course, again, social distancing should be practiced, and then you also need to discuss that with your employer if alternative arrangements can be made. However, if you have got a heart condition, that puts you at a higher risk of developing COVID-19 symptoms, and public and NHS England is actually sending out letters to those specific high-risk people, advising them to isolate or practice shielding. One other thing I would like to advise for healthcare workers specifically, that healthcare pregnant women, they should be given a choice whether or not they would like to continue to work, regardless of which trimester, which semester they are in where they are in their pregnancy. And if they choose not to, then the decision should be, should be respected. Now, these are all the guidelines that I have taken. These are all the guidelines that I've taken from the Royal College of Obs and Gynae, and it is available on their website as well. Any confusion for these pregnant women regarding if they need any further guidance on how to practice social distancing, Public Health England has got guidance on that, and I would advise all pregnant women to go on the website and read further, or we can provide information if they need it.
Thank you, Dr. Khalid. Now we'll move on to questions from the audience. So if anybody has any questions, please raise your hand and then we can get you to ask your questions live. So,
Hello. I'm 9 months pregnant, about to go in, I guess, in a couple of weeks, and I just wanted to know if I could still have a water birth.
Okay, so water birth at the moment recommended, and the reason is because there has been evidence that the virus can be transmitted or spread through the feces. So at the moment, NHS England is advising for all waterbirds not to be carried out, particularly for the fact that, one, you're at risk of having the virus, plus at the same time, this puts the baby at risk of contracting the virus. Also, the staff available, I don't think that they don't have the facilities, the proper equipment to facilitate the waterbird at the moment.
Thank you, Dr. Khalid. The next question is from Vin, please.
Hello, my wife is currently pregnant, and I've heard that if she needs to take lots more vitamin C. Is this true?
So there's a lot of myths going around that certain medication or certain remedies can prevent you from getting coronavirus. Vitamin C is good for your immunity, but in no means it will actually protect you against coronavirus.
Okay.
Thank you. Any more questions?
I would just like to add one thing here. Just remember, to all our patients, the risk, the way you can reduce the spread is, one, maintaining social distancing. Second, practicing good hand hygiene. So wash your hands. If you're sneezing, make sure you're using tissues and you are putting that in the bin. So all the basic hand hygiene measures if you can.
Thank you, Dr. Khalid. Thanks for joining us, and thank you for answering all those questions. We hope that this webinar has helped in providing some clarity and helping you understand what the risk is and how you can protect yourselves. So thank you. We'll have some future webinars addressing other situations.
Thank you everyone for joining us.